millions of Americans with weakened immune systems should get a fourth shot of the COVID vaccine, according to the CDC. But many hospitals and even pharmacies are turning patients away, and it's unclear at this point why. Dr. Perry Wilson is an associate professor of medicine at Yale University. Thank you so much, Doc, for joining us this morning. Where is the disconnect here? Because I feel like it's getting very confusing. It has been from the start, and a lot of these patients, they need this fourth vaccine.
Yeah, the data is really clear that for people with moderate to severe immunosuppression, so, cancer patients, people with transplants, they really do benefit from that fourth dose. The CDC recommends it. There's no reason for pharmacies to be denying this. And so the question is why? The only thing I can think about is that, once again, communication from CDC to the pharmacies just has to get more clear. They need to provide these to people who need them.
Communication or lack thereof, right? A universal coronavirus vaccine to protect against all variants is still a few years away, but this is great news. If and when it is ready, would this be something that you'd have to get one time or a few times a year, like the flu shot, or do we even know?
Well, it's certainly too soon to say. Only one of these potential candidates is even in human trials yet, but it is really exciting. These vaccines target parts of coronaviruses that don't mutate much, that are very stable, not just within SARS-CoV-2, the one that's causing the pandemic, but across multiple coronaviruses, including some endemic coronaviruses that we know as viruses that cause the common cold. So you might get some protection against the common cold, but before you get too excited, coronaviruses only cause about 20% of common colds. Rhinoviruses and other viruses cause a bunch more. So we're not curing the common cold yet, but this is a great development.
And, for those patients that are struggling and they're confused, right? They want to get this fourth shot if they fall in that category, but they are indeed turned away from a pharmacy or a hospital. What advice do you give to them?
You come prepared. Go to the CDC website and print out the guideline recommendations that say that immunosuppressed people should get a fourth shot, and show that to whoever is denying it to you. If they're denying it to you, ask to see their supervisor. This is the kind of thing where you are in the right. So go ahead, ask questions, be calm and patient, and explain the situation. But you do deserve to get this if you need it.
Dr. Perry Wilson, thank you so much for your expertise.